This is not an episode about decline. It's not the story I'm interested in telling. Midlife is not the beginning of the end. It's when we finally start paying attention. It's when we get honest, take ownership, and stop accepting that normal aging is the only explanation for feeling like a lesser, different version of yourself. On today's round, we're picking up where we left off in the sex hormone conversation. Last round was testosterone, today, progesterone and estrogen. Before any of you men listening reach for the skip button, let me say this directly. Stay with me. This episode matters for you too, and I'll explain why in a minute. Welcome to Playing for Life, the podcast where golf, hormones, and midlife performance are finally in the same conversation. I'm Dr. Amy Garza, a midlife hormone expert, aspiring competitive golfer, and someone who believes better performance starts from the inside out. On this show, we connect what's happening in your body to how you show up on and off the course. It's about building a body that lets you live better, play better, and stay in the game longer. Because midlife's not where you stop playing, it's where you learn how to play for life. Let's tee it up. All right, quick recap from last time. In case you missed it, the three sex hormones, testosterone, estrogen, and progesterone, are not male or female hormones. Both sexes produce all three. The differences are quantitative, not qualitative. Same hormones, different amounts. We talked about testosterone last round and how it matters for both men and women for muscle, bone, energy, drive, recovery, mood, confidence, and yes, libido. If you missed that one, go back and listen. Today, we're moving on to progesterone and estrogen. Quick note, before we get into it, I'm a doctor, but I am not your doctor. This episode is for education only, not personal medical advice. Use it to have a smarter conversation with your own doctor. You probably think progesterone and estrogen as women's hormones. A lot of people do, and it makes sense. Estrogen and progesterone fluctuate in a woman's body enough to create her monthly cycle. They're the reason she has periods that would allow her to get pregnant and have babies. They also contribute to PMS and the emotional roller coaster of perimenopause. As a woman gets older, these two hormones can have a radical impact on how she feels. Men, if you're married or in a serious relationship, you know when a woman's experiencing these changes because you're feeling it too. Unlike testosterone, which has a radical impact on both men's and women's performance, estrogen and progesterone are present in much smaller amounts in a man's body. They have less of an impact on overall performance for men, with a couple notable exceptions. The first one is body composition. Estradiol, which is the primary estrogen in our bodies, mediates testosterone's effects on fat accumulation. That's just a fancy way of saying that when estrogen levels fall too low, fat accumulates, even if testosterone is still present. So low estrogen is associated with being a bit more fluffy. The second one might catch your attention a little more, men. It has to do with your erections. Estrogen receptors are found throughout the part of the penis that fills with blood to cause a good erection. Appropriate estradiol levels are important for good erectile function. Too little and too much are both related to poor erectile quality, which affects sexual performance. We'll spend plenty of future episodes talking about all things sexual health, but for today, just make this connection. Estrogen matters for men too. Okay, back to women. And men, don't tune out, because if you're in a relationship, the way a woman's estrogen and progesterone affect her is definitely impacting you as well. If she's not listening, you're going to want to share this with her. Let's start with progesterone, because I think this is where I've been able to move the needle the most for women in their perimenopause experience. It's also where I think my background as an anesthesiologist has given me an edge in midlife care. Progesterone is essentially your calming hormone. Sure, this is an oversimplification, but I think it helps when you use this lens. It can help you transition through perimenopause so much more smoothly. Progesterone is the first hormone that starts to decline in women, typically around age 35, sometimes earlier, sometimes after the birth of a child, which means around the age of 35, a woman's calming presence starts to go away. What does that look like? You might recognize it. Anxiety, irritability, edginess, insomnia, heavier periods, all signs that the calming presence is going away. That's when we should start paying attention. If you do this long enough, you start to realize there's no one way that bodies change. If I could teach primary care doctors one thing I've learned over the last decade plus, it's this. If a patient has a brand new symptom, any symptom they've never had before, and there's no obvious cause, and they're somewhere in their 30s, maybe early 40s, it's perimenopause until proven otherwise. The number of people I have seen who've gone through countless workups and tests, evaluations for things like palpitations, night sweats, ear ringing, dizziness, headaches, you name it, only to find out it's nothing because it's hormone shifting and changing in a way that is not standard, not predictable, and not anything you'd pick up on a lab test. This is a clinical diagnosis. Lab testing isn't going to catch it. I was fortunate enough to only treat people one way in the beginning. It was probably due to fear since I was just learning all of this. It was also new to me. The way I started treating patients when they showed up with anything that seemed hormonal was progesterone. I started doing it a little bit differently pretty early on. I started thinking about the way I gave medicine on the operating room table, and so I started titrating progesterone in similar patterns based on how patients' symptoms were. I started listening to their stories. Women were telling me they were symptomatic here and there, like they knew when they were having problems. In traditional medicine, we treat perimenopause only after women have stopped having regular periods. And really, only for 14 days of the 28-day cycle do we treat them. It's just so few people. But when I started treating it differently, letting women treat themselves when they had their symptoms, it was like magic. If I could only prescribe one medicine to a woman in perimenopause, it would be progesterone in a way that was unique to her, that suited her symptoms and her response. Because every woman is different, and there's a lot of ways to prescribe progesterone. We have commercial preparations, compounded preparations. We can create any combination of the two. But you have to know how to do that. If you wish that your doctor knew more about how to do this, or you want to know more about how to take progesterone this way or get prescribed progesterone this way, let me know in the comments and we can dig much, much deeper into this. It's really important. See, I'm really thankful for my anesthesia background. It's that experience and that little bit of fear I had in the beginning for trying something new that allowed me to discover that women can feel as great as they want as they transition through perimenopause. Yes, there are going to be some hard days. We can't completely change what the body's doing. But if we just think logically about this, the first hormone that starts to decline is progesterone. Let's just give it back. What does that mean for your golf game? Well, replacing progesterone can mean less anxiety over short putts, less difficulty recovering emotionally after a bad hole. It can feel like being rested for a tournament because you actually slept well the night before. Less mind racing when you're standing over the ball. Not having to withdraw from tournaments for heavy, painful periods. So often in medicine, we tell people to suck it up, try harder, it's just the way it is, or worse. We prescribe anti anxiety medicines, pain medicines, sleep medicines, antidepressants. Too often, this is just treating symptoms and often creating new problems instead of looking at why those pre tournament jitters are worse than they've ever been, or uncovering the real cause of why you haven't slept in months. If you want to play better golf, over medicating isn't the way to get there. Optimizing your hormones, naturally replacing what's simply declining in your own body, can make all the difference in the world. Okay, now let's talk about estrogen. Yes, estrogen is about reproduction and pregnancy, but let's not sell it short. It's involved in so many systems in the body. I like to describe it as structural. It's part of what holds the body together. Estrogen supports bone density, cardiovascular health, brain function, memory, focus, verbal fluency, skin health, joint health, even mood. It's responsible for parts of body temperature regulation, sleep quality, urinary health. We have estrogen receptors all over our body. So when estrogen starts changing, it can be felt everywhere. What's interesting about estrogen is that it doesn't necessarily just slowly decline in midlife. It often fluctuates, and this can be due to hormonal cycling in women, but also be due to weight fluctuations, environmental exposures, and the nutrition we use to fuel our bodies. It fluctuates. It can be high one month, low the next, high one day, low the next. It's erratic, unpredictable, and it's why women often feel like they're losing their minds. Every single day, I hear somebody say, I feel like I'm going crazy. I just want to feel like myself again. Or I just can't take it. I'm so tired of feeling 1 second terrible, 1 second fine, the next second terrible. That roller coaster is very hard to live with. And if this is you or your spouse, I know it's put strain on you and your family and your relationships. I want you to hear this. It doesn't have to be this way. I like to tell patients that if progesterone is the calming influence, estrogen is the stimulating influence. I think about it this way. Estrogen is the fertilizer on the grass, and progesterone is the maintenance crew mowing the fairway. They work together, and when they're in sync, it's a beautiful thing. When the body is struggling, it's not virtuous to ignore it. It's wise to understand it. For women, all three of the sex hormones radically affect your performance on the course. And for men, even though testosterone is the primary driver of your performance, listen carefully. If the woman in your life is sleeping poorly, anxious, irritable, waking up at 3 a.m., overwhelmed by things that she used to handle, and feels like something is just off, you're both suffering as a result. So here's what I want you to take from these last 2 episodes together. Testosterone, estrogen, and progesterone are the big sex hormones. Men and women have all three. We have them in different ratios and they change in different patterns. But both men and women need a functioning hormone system. These hormones affect more than just performance on the course. They impact sleep, mood, focus, recovery, body composition, sexual function, cognition, stress tolerance, confidence, motivation, drive, and so much more. They really affect your ability to feel like yourself in your own body. When I say hormones affect your golf game, I'm not suggesting that estrogen made you three-putt. I'm not saying testosterone made you miss the fairway, although we'd all like an excuse every now and then. But what I'm saying is that your golf game is played through your whole body, and your whole body is influenced by your hormones. You don't swing the club with a lab value. You swing it with muscle, balance, and coordination. You play with focus, energy, and confidence. You need to be able to recover, and you need a nervous system that's regulated. Your brain needs to be sharp and not foggy. You want joints that feel good and don't ache. You need to sleep so you can repair, recover, and feel restored for your next round. And hormones influence all of that. If you're only looking at your swing, you may miss this important system. If you're only looking at your score, you may miss the signal. If the only thing you're doing is trying to grind harder, you may miss the invitation to understand what your body actually needs. Sometimes the thing that frustrates you is the thing that finally gets your attention. Maybe you've ignored the fatigue, the sleep, the low libido, the irritability, and the brain fog. Maybe you even ignored the fact that you didn't want to work out anymore or that your workouts weren't working anymore. But then your golf game changed and now you're paying attention. Good. Pay attention. Get curious. Start asking what your body is trying to tell you. That question changes everything. I want to leave you with one important thing because patients are getting dismissed at the doctor's office time and time again. If you find your way to your doctor's office and you walk away being told that your labs are normal and that everything's fine, but you know something is off, pay attention. When someone knows something's wrong in their body and they're told everything is fine because the lab range says so, it's incredibly invalidating and super frustrating. Believe me, we'll come back to this conversation because it deserves special focus. I mean, what is normal anyway? So here's the foundation I want to make sure you understand. Testosterone matters for men and women. Estrogen matters deeply for women and still matters for men, especially for bone, cognition, sexual function, and cardiovascular health. Progesterone matters especially for women, supporting sleep, calm, nervous system regulation, and stress tolerance. When these hormones shift, your life shifts. Your body, your relationships, your workouts, your golf game, they all shift. Not because you're broken, but because your system is changing, and systems can be understood, supported, and rebuilt. It's the hope I want to leave you with. This is not an episode about decline. It's not the story I'm interested in telling. Midlife is not the beginning of the end. It's when we finally start paying attention. It's when we get honest, take ownership, and stop accepting that normal aging is the only explanation for feeling like a lesser, different version of yourself. I don't believe the goal is to chase who you were at 25. It's not the point. The goal is to build the strongest, clearest, most connected, most alive version of you for the season you're actually in. So you can go and do the things that you really want to do. For golfers, that matters because you're not just playing for a score, you're playing for life. You're playing because the game gives you something. It's a reason to keep getting stronger, to keep learning, to stay in the arena. And I think that's beautiful. If you want to keep playing this game well, you have to take care of the body you bring to it. You can't ignore it. Here's what I want you to think about this week. Where has your body been trying to get your attention? Where has your golf game been trying to get your attention? Where have you been explaining away your symptoms when they deserve a closer look? Where have you been saying, I'm just getting older, when maybe your body is actually asking you to lead it differently? The second half of life asks for a different kind of leadership. You can't operate on the same habits, same assumptions, same recovery capacity that got you through your 20s and 30s. Midlife requires a new strategy, and that strategy starts with understanding your body. In the next episode, we're going to dig deep into how to identify with your doctor whether this is an issue for you. We're going to talk about why normal labs might say you're fine when you're absolutely not feeling fine. The conversation will make you a little bit angry at times, but in a good way. The kind of angry that finally helps you stop dismissing yourself and take action. For now, remember this. Your body, it's not betraying you. It's sending you a signal. It's talking to you. Your pain, it's not just frustrating you. It's informing you. And midlife is not where you lose yourself. It may be where you finally learn how to listen. If something in today's episode hit the sweet spot for you, do me a favor. Follow the show so you don't miss what's next, and share it with someone who needs to hear it, especially someone who knows their body, energy, or confidence has changed but hasn't known what to do with that information. Drop a comment and tell me what landed or what you want me to dig into on a future round. Your questions shape where this show goes next. Until the next round, this is Playing for Life. Here's to living better and playing longer.